बारावीचं पासबुक आणि तुमचं DRDचं प्रमाणपत्र.
घर पे निकाल ऐसा था कि मैं सड़क पर गिरने के चिमटे की तरह लेट गया। पूरी टोली थी रामी के साथ। मुझे
हेलो। हेलो।
हेलो। अब 12 बजता है ना?
नाही बंद केलंय ब्लूटूथ असंच आवाज येईल आता. आवाज येतो नाही ब्लूटूथ बंद. ಸ್ವಲ್ಪ ಆದರೂ माझी विसी ठेवलंय का बरोबर आणि आवाज ऐकायला पण
हो अर्चना पुढे मॅडम
नाही करत आपण तसं
ये रेहान अपना काम नहीं है लेकिन वो कर रहा बेटा अपना। ये बात है जाएगा। आओ sama kopi itu mata dan tidak buat
जॉईन झाले का? जॉईन झाले का म्हटलं?
12 वाजता आहे ना?
नाही
पदवी करायला तपासले म्हणून कॉलेजमध्ये आठवण भरपूर दिसत.
तर आवाज येतोय माझा?
येतोय सर.
ओके ओके ठीक आहे.
हेलो।
हेलो। मला वाटतं ना
नाही. आवाज येतोय का?
हॅलो, आवाज येतोय का?
हा येतोय आवाज.
ओके. गुड मॉर्निंग ऑल. आपल्या अधीनस्थ सगळ्या मॅक्सिमम लोकांना अटेंड करायला सांगा. एक साधारण फार वेळ नाही लागणार आहे, पण कुणाला मिस नको होऊ देऊ दे. थोडंसं NHSRC मधून आपल्याकडे जॉईन होत आहेत लोक, तर आपण त्याचा लाभ घेऊया. आणि ही VC झाल्यानंतर जी नेहमी वेबिनार जो असतो त्याचा फ्लायर आपण फॉरवर्ड करतो, तर तेही त्याच्यानंतर ही VC संपल्यानंतर आपल्या फॅसिलिटीच्या सगळ्या लोकांना अटेंड करायला लावा. तसं आपण मेल केलेला आहे, त्याची लिंक पण पाठवलेली आहे. अनम्यूट अनम्यूट.
माझा आवाज येतोय का सर्वांना?
हो सर येतोय. हा येतोय आवाज.
VC ची लिंक आहे ना, फक्त आपल्याला 450 लोकांनाच ऍक्सेप्ट होईल. त्यामुळे 300 लोकांना होईल. त्यामुळे इतर लोकांना तुम्ही युट्यूब लिंक जी पाठवलेली आहे त्याच्यावर जॉईन व्हायला सांगा. युट्यूब लिंक पाठवलेली आहे त्याच्यावर जॉईन व्हायला सांगा बाकीच्या लोकांना. कारण आपली कॅपॅसिटी फक्त VC लिंकची 300 लोकांची आहे. इतर जे CHO आहेत, THO आहेत, जे ग्राउंड म्हणजे फॅसिलिटी लेवलवरून जॉईन होणार आहेत, त्यांच्यासाठी आपण युट्यूब लिंक जनरेट केलेली आहे, त्या लिंकवर जॉईन व्हायला सांगा. आणि आपण प्रत्येकाला मेल केलाय, ग्रुपवरती पण युट्यूब लिंक दिलेली आहे, त्या लिंकचा ओपन करून त्यांना जॉईन व्हायला सांगा.
कृपया सगळ्यांना आणखीन जॉईन झाल्यानंतर माईक वगैरे बंद करायच्या सूचना आपल्या स्तरावर देण्यात याव्यात. सारखं मग इथून डिस्टर्बन्स होऊन जातो प्रेझेंटेशनला, तेही एक त्यांना सांगा.
Good afternoon, everyone. Am I audible? Am I audible?
Yes, sir.
Yes, sir.
Kindly confirm the PPT also. I am sharing from here.
We can see your PPT.
Is it visible
Not now.
now?
No.
Please check.
Please
Is
share
it
one.
visible?
So please share it.
Yes.
Now it's yes, visible.
Now visible? Okay. Thank you.
Yes. Please
Open in
wait.
reading mode, sir. Open in reading mode.
Sorry.
Open in reading mode, not in presentation mode. So
So
you
it
can.
is in the reading mode, na?
Yes.
Okay. And now it is changing.
Not.
Not yet. तर आम्ही सांगून येते.
Is it not changing?
No, sir. No, sir.
Okay. IT वाला मिल गया ना? Is the screen visible now?
No.
Navin Kumar ji, good morning.
Good afternoon, sir.
Yeah.
Sir, I'm just checking with the team whether the PPT is visible or not.
Yeah, it's not visible yet.
Okay. I'm just sharing from here.
Madam.
Can someone confirm? Is it visible now?
Yeah, it's visible. Yes.
I'm just checking that. Is it changing now?
Yes.
Slide?
Yes.
Okay. So, can we start, sir?
Yeah, we can start. I'll just have a brief remarks.
Yes, sir. Yes.
And we
Yes,
can
yes.
start, because
Yes.
almost 300 participants are there through this link, and around 300 are on YouTube. 477.
Yes,
Number is
sir.
increasing. Should we wait for a few minutes?
Yes, sir. We can wait for like 2 or 3 minutes more.
Yeah, because on the YouTube, so many people are joining.
Yes.
We'll wait. Yeah. Thank you. All the divisional team and district team, so please kindly ensure maximum people to join, because this is a very important session for the particularly quality assurance program. I know many of us are trained and many of us are knowing the program in detail, but still some of the officers, the field might be new, and now we're focusing on primary health care. So I expect the maximum CHO, DMO, Taluka Health Officer to join, and the district team, civil surgeon, DHO, all the deputy director and his team, DQAC, DPM, CPM should join. So it's a 1.5 hour session. Urban area MOH should join. We need to kindly ensure that all the district officials are joined from your side. We'll not waste our time in taking the attendance. We'll wait for few minutes and then we'll start. Ata, see now, Santosh, how can I join on YouTube? For joining this session and giving you a precious for the state of Maharashtra. My team and all the district teams are working very hard to achieve the targets up to 50% by December end. Even the state team is also working on that. So for the district team now, few instructions I will give, then we'll start the session.
Yes, sir.
So I all the deputy director, CS, DHO, DD, district teams are connected for this VC. Now our target should be for the Aishman Arogya Mandir, Subcenter, PSC and UPSC. And you all know the QSCs are being reviewed frequently from the state. We all know how to achieve it. And for that, we have to first of all target the low-hanging fruits like the Kayakalp award winners. Then IPHS ODK tool kids score more than 80%. Those facilities you have to target. And it is very easy to target the subcenter PSCs and UPSCs because the checklist is also small. Some of the particular things you have to achieve, and that can be sensitized from the district also after this session. So you have to follow with the facilities which are achievable, which can achieve the score more than 70. And within a week, you have to send all the proposals for such facilities. I'm telling you regarding the primary healthcare facilities. Doesn't mean that the hospitals are not to be targeted. All the civil surgeons also kindly note the medical superintendent of the hospitals have also joined. So you can send your proposals from the hospital side also, and if bigger hospitals are there and some of the departments are not achievable, If you feel like that, then you can focus on some of the departments like the labor rooms and your operation theaters. You can focus on Muskan, Lakshya program, and particular departments you can apply in, wherein you can have the score more than 70%. Then one very important thing is regarding the manpower. Like the DQC is now, as I have already told you in previous video conference meetings, the DQC shall not be given any other responsibility. All the DD, CS, DHO, MOH, kindly note. Now dedicated task for the NQAS has to be performed by the DQAC. So kindly don't give any other responsibility, rather give him the support from other teams like IPHS coordinator and other coordinators which are having less work. Even the program officers from TB, leprosy may be pulled in to support this team. And all the supervisory officers from DHO side, RCH officer, ADHO, ACS, from civil surgeon side, outreach RMO, they have to be looped in and to support this team by any way. As you want to achieve the target of 50% by this December end, so it is a Herculean task now. You have to work very hard for this. Otherwise, we may not achieve it. As already Maharashtra is very low performing in these targets of NQAS. So this much things I want to tell you. We'll again review in our meetings, but now I request all the teams from the districts and down level facilities to kindly listen this sensitization meet, wherein Dr. Naveen Kumar from NHSRC will be guiding us, and he will be giving us some of the tips how you can expedite the process of achieving the quality assurance targets. Thank you very much. Kindly, Naveen Kumar ji, can start.
Thank you, sir. Thank you. Thank you very much. Good afternoon, everyone. Namaskar, sabhi ko. Myself, Dr. Naveen, Consultant Quality and Patient Safety Division, NHSRC. And I heartily thanks to DHS sir and the state team for inviting NHSRC for this particular orientation and capacity building kind of training orientation. As sir has mentioned that this is particularly for the primary healthcare facilities where we are looking for the PHCs, urban PHCs, as well as the armed subcenters which are functional in the 36 states of the 36 districts of the state. So the I will look upon how we can proceed and how we can strengthen the implementation of particularly NQAS standards is at these primary healthcare facilities, and how the certification process can be further strengthened and the number of facilities can move for achieving the particular state certification and national certification. As sir has also mentioned regarding the targets which are notified by the Honorable Health Secretary letter of 3rd January 2024 regarding the 50% of NQAS certification by December 25 and 100% NQAS certification of all level of healthcare facilities by December 2026. Briefly, I will take a session regarding the process of NQAS framework and its nitty-gritties, along with as sir has requested during the meeting in NHSRC on visit of sir on 20th November regarding the orientation of facilities and staff regarding the Saksham portal. So next session will be taken up by the Dr. Neeraj Gautam, Senior Consultant Certification Unit NHSRC. And we will also look through the what strategies we can take up next and what are the any challenges faced by the state or district teams. So can anybody confirm that these slides are visible?
Show?
Yes, sir.
Yeah. So briefly regarding the evolution of quality in healthcare in India, the journey started in 1992 with the launch of Child Survival and Safe Motherhood Program focusing on maternal and child health. Later on,
Naveen ji, can you make it full screen?
let me try, sir.
Slide show. Yeah. please.
Is it now visible? Is it
But it is in edit mode.
now it is changing?
No.
Okay, that is the issue. Okay, I will briefly emphasize on each and every point.
Yeah, okay.
The journey started in 1992. Later on, the launch of RCS, that is Reproductive Child Health Program, in 97. 2005 was the launch of NHM, as well as the launch of National Health Mission for improving the availability and access to quality healthcare in all the public health facilities. Later on, 2007, the IPHS standards, uh, Indian Public Health Standard for all level healthcare facilities, were launched and later on revised in 2012 and 22. The latest version is available at NHSRC and Ministry site. You can also look upon these IPHS standard for requirement of like HR, infrastructure requirement, so these components are well addressed in these IPHS guidelines. Then 2008, the implementation of QMS, that is Quality Management System, ISO 9001, and some of the states like Kerala has tried the CASH system, that is Kerala Accreditation System. FFHI, NABH was done by some of the healthcare facilities. 2008 to 2012, around 147 facilities has achieved the ISO 9000 one standard, that is International Organization for Standardization. So this journey continued, and then the NQAS program was first launched with the launch of National Quality Assurance Standard for the district hospital facilities in 2013. Later on, standard for the PHCs, CHCs were launched in 2014. 2015, the uh, looking at the Swachh Bharat Abhiyan, SBA, Ministry of Health and Family Welfare launched the Kayakalp program, that is Kayakalp initiative for improving the sanitation hygiene and improving the infection control practices in public healthcare facilities. There is also provision of incentivizing the winner facilities under Kayakalp each year. That is, annual assessments are being conducted under Kayakalp. Then in 2016, Ministry of Health and Family Welfare launched the NQAS for urban PHCs and AEFI surveillance, as well as Triple S. Lakshya and Mera Aspatal was launched in 2017. Mera Aspatal is basically significant in the context of uh, uh, like we are also calculating the 15% of weightage has been given in the Kayakalp external assessment. This is a patient feedback mechanism. 2018 patient safety implementation framework was launched, and Mera Aspatal integrated with the Kayakalp. Triple S, that is Swachh Swasth Sarvatra, was launched in 2019, and 2020 we came up with the guidelines for Ayushman Arogya Mandir sub-health center, which are the largest number of healthcare facilities in country now, and most of the state are focusing on uh, the NQAS certification of these healthcare facilities, as well as uh, another provision in this regard is given as the virtual assessment of the Ayushman Arogya Mandir. We will see in the details. Then Muskan revised OG was launched, operational guideline for NQAS, that is in 2021. 2022, Sakushal tool was launched for the self-assessment of district hospitals. And then 2014, the latest are the virtual NQAS assessment of Ayushman Arogya Mandir, and NQAS for integrated public health laboratories were launched, along with the Kayakalp revised guideline, where we have integrated the WASH indicators as per the international requirements in the Kayakalp guidelines. These are the international recognition for the national quality assurance standards, where the certification unit, as well as the surveyor training program and the national quality assurance standard itself are being recognized and accredited by the International Society for Quality in Healthcare. Nationally, these are also recognized by the NHA, that is National Health Authority, and the IRDA, Insurance Regulatory Development Authority, for achieving the national and state NQAS certification. This is the letter which I was talking regarding the 3rd February letter of Honorable Health Secretary regarding achieving 50% of NQAS certification by 2025 and 100% of NQAS certification by 2026. This was issued after the Chief Secretary's conference, where it is emphasized that all level of healthcare facilities should achieve the NQAS certification by December 2026. NQAS framework, as I also discussed, the framework is basically NQAS standards are available for all level of healthcare facility, right from the DH, SDH, CHC, PHC, UPHC, and ARM subcenter. So all level of healthcare facilities are covered under the NQAS framework. Muskan and Lakshya Muskan is basically for the child-friendly services, where we are targeting basically the pediatric OPD, ward, SNCU, and NRC in the district hospital level. And under the Lakshya program, the maternal OT, and labor room are being covered. Now the integration process of this Lakshya and Muskan is undergoing in the NHSRC, and now onwards, when the notification will be issued by the ministry regarding the integration of Lakshya and Muskan in the NQAS, there will be only one certification, that is NQAS certification, and these Lakshya and Muskan departments will be the part of that particular integrated NQAS checklist. Then patient safety, every year we celebrate the Patient Safety Day on 17th September, and we have particularly a special tool for self-assessment of healthcare facility, where facilities are assessing on the patient safety parameters and submitting the scores with the NHSRC and ministry. Last is regarding Kayakalp. Kayakalp is a well-recognized program where facilities are being incentivized and recognized for their participation, and as well as improving the cleanliness, hygiene, infection control, and waste management practices. Three level of assessment is being undertaken, like internal, peer, and external assessment. One thing has been introduced in the revised guideline 2024, where we have emphasized that if the facility is not WASH compliant during the external assessment, it will not be qualifying for the Kayakalp incentive. So, qualifying in the WASH parameters is being mandatory to during the Kayakalp external assessment for achieving the Kayakalp incentives. One parameter we have also introduced, where in July 2025 we have issued a letter that once the facilities are Kayakalp winner facilities or incentivized facilities in particular year, these facilities should be prioritized for the at least NQAS state certification in next 3 months, so that they will be getting two incentive. One incentive on the behalf of Kayakalp, as they are Kayakalp winner or commendation winner facilities. Secondly, if within the period of 3 months they will achieve the state certification, they will also get the state certification incentive and recognition and certification from the SQAC. So this letter has been issued by the ministry in July 2025. I duly emphasize that due dissemination and importance should be given, so that the facilities which are coming up with the Kayakalp scores or winner facilities can be prioritized for NQAS state and national certification respectively. This is the foundation of NQAS, that is based on the structure, process, and outcome. Structure, where we are looking out for the infrastructure, human resource, and equipment supply. Basically, processes, we look in the clinical process, support process, and administrative, and outcome is regarding the how the facilities performing on the functional outcomes or clinical outcomes, and these are being adequate and being utilized by the people or the mass population receiving living in that particular catchment area of particular healthcare facility. So I want to emphasize here also that the NQAS is totally 79% is process based. How you improve the process is very important. Uh, like infrastructure structure part is only 8% and outcome is 13%. So majorly it is the process driven system, where we can improve the process, whether it is in the laboratory, in the OPD, in the IPD, or pharmacy, any department, or particularly we talk about the sub health center, The process can be improved where registration of the patients, entries of the patient in the particular portals. If it is a delivery point, the number of deliveries which are conducting, infection control practices, biomedical waste management, as well as the availability of drugs. These are the process-based standards when you go through the checklist. That is why it is emphasized that facility should take up the internal assessment every month so that they can easily identify what are the gaps and where they can prioritize and improve the particular gaps which are being identified. This is the institutional framework under the NQAS, where the national level we have CQSC, that is Central Quality Supervisory Committee, headed by the MD NHM. And basically the TORs include approval and ratification of quality standards and guidelines, strategic direction, monitoring of quality assurance activities, approval of NQAS certification criteria if there is any changes in the criteria of certification, creation of pool of national assessor, that is external assessor which are going for the particular assessment of the facilities, and resolution of appeal and ethical issues through the appeal committee. These are the TORs or particular NQAS, that CQSC, that is Central Quality Supervisory Committee. At the state level, same, we have the State Quality Assurance Committee and unit SQSC and SQAU, which are taking the strategic direction and uh, decisions regarding the implementation of NQAS in particular state. SQAC is the apex committee in the state, and the SQAU unit is the particularly for supporting the implementation of NQAS. At same replication at the district level, where DQAC and the DQA, District Quality Assurance Unit, are being formed. And at the facility level, we have the quality circles and DQT, that is district quality teams, which are functional. The detailed TOR role responsibilities has been mentioned in the OGs, that is operational guidelines for NQAS 2021. The what are the who are the members of this particular committee, what are the roles and responsibilities which are assigned to it, and all the TOR has been explained in detail in the OGs. So I request the particular teams, whichever they are functioning or locating, they please go through these TOR for understanding and strengthening these institutions in the particular state, whether it is SQAC or DQAC in the particular districts. And monthly review should be taken by these committees for functioning and improvement and progress of the NQAS implementation process. And if any mid-course correction is required or any direction, that should be communicated effectively. This is particularly regarding the Maharashtra. I have prepared this slide that approved HR posts which are under the quality assurance program, because I think this is one of the challenge in the Maharashtra where we are lacking some of the HR availability, particularly at the state level, district level, where at the state level we have 4 posts. One is for the state consultant quality assurance, second is state consultant public health, third is state consultant quality monitoring, and fourth is the program assistant, who will be assisting the particularly SQAU and SPC. Same replicated at the district level, where 3 consultant and 1 program assistant is being approved under the OG, operational guidelines of NQAS. Facility level, we have quality team and quality manager at the district level, and informal groups like the quality circles in the labor room, maternity, OT has been approved under this NQAS framework. This is the assessment process, where the first assessment is internal assessment, where, sorry, given in a year as per the NQAS checklist, gap analysis is done by the team which is working at the healthcare facility level. SOP and work instructions are prepared, and other gaps like calibration of equipment, EQAS, external quality assurance, and reporting of quality indicators like reporting of KPIs and monthly PSS, patient satisfaction survey. These things are being conducted at the facility level, that is the internal assessment. Second level is regarding the state assessment, scores are validated at the state level once the internal assessment is completed and score are submitted to the DQAC. Then DQAC validate the score and submit the score after the visit to the facility to the state assessment for the particular validation at the state level. Once the state assessment is completed, the state may apply for the national certification, where through a team of impaneled external assessment, the national assessment is conducted by the assessors, particularly in the pool of ministry. So this is as per the NQAS certification criteria. The assessments are being conducted by the external assessors. Surveillance assessments are conducted every year for consecutively 2 years once the facility is being NQAS certified. NQAS certification is valid for 3 years, but during these 2 years, state has to submit the surveillance assessment of these particularly NQAS certified facilities. This is also being conducted by the impaneled external assessors. Recertification, once the 3-year duration is coming to an end, the state is sent a notification regarding the recertification of these facilities at least 3 months prior to expire of the certification. Facility and state is informed that these facilities are going for expiry of their NQAS certification. Kindly apply for the recertification. So this is the basically the NQAS implementation of the facilities. I will also be sharing these PPTs if required for the particularly orientation of the staff or the state and district teams. First is the setting up the district team or circle, their capacity building, formulation of quality policy and scheme, SOPs, decentralized and documentation of standards, SOPs, and interdepartmental coordination. These are done by the quality team, which is particularly placed at the facility. Training and capacity building is ongoing activity. Every month, if they are conducting any kind of training, they please maintain the records of these training, whether in infection control, biomedical waste, SOPs. This is done by the quality team placed at the particular healthcare facility. Assessment of facility, monthly assessment at the facility level, quarterly assessment by the DQAU, District Quality Assurance Unit, and at least biannual assessment by the SQAU, State Quality Assurance Unit, for the facilities which are being prioritized for the NQAS certification. Traversing the gap, where once the after the internal assessment, once the gaps are being identified, they are being prioritized, like it is structure based gap or process based gap or outcome based gap, or whether it requires the facility intervention, district intervention, or state intervention. So as per the prioritization, the uh, convergence and prevention of action has been taken to prevent further uh, occurring of these gaps, and the gap closure report or ATR should be submitted. Then regulatory and statutory compliance is required at the particular healthcare facilities, like the biomedical waste authorization, fire NOCs. These should be a facility should adhere to these or regulatory requirements, because these are also the part of the mandatory standards. Mandatory standards where the facility must secure more than 70% marks in these particular standards. Like if I talk about the district hospital D10 standard, where we are talking about the statutory and regulatory compliance, the facility must ensure that these are being available with the facility. Then facility level NQAS implementation is regarding the internal assessment, PSS and KPIs. These data should be shared with the particular DQAC and SQAC regularly, monthly. Then this is the uh, further process. When the scores are being validated at the DQAC level, they can review the score and submit for the state certification. State certification review and review of applications which are being received from the DQAC, assessment of healthcare facility, review of the report, and issue of certificate to the facility for period of 6 months. Now the state certification is for the period of 6 months. Like when the facility is uh, assessed at the state level and being state certified, during this 6 month period, the facility can prepare for the national certification. Likewise, for the Ayushman Arogya Mandir Sub Health Center, this system has been decentralized, where the DQAC or DQAU can conduct the assessments once the score are received from the healthcare facility, and then submit the scores to the SQAC or SKU, where the validation of these scores has been done, and further state certification is issued, and facility can be prepared for the national certification in next 6 months. National certification is also after receiving of application and verification of documents, assessment is scheduled, and quality certification awarded by the MOHFW. Periodic reviews has been done, time-bound action plans are being checked, and these facilities, as they are to sustain the initiative, incentives are inbuilt mechanism under the NQAS, where the facilitation and recognition of achievements has been done. Recertification, as I have mentioned, at recertification at least expiry, apply for recertification at least 3 months prior to end of the period. Surveillance and sustenance is particularly a challenge, where the annual surveillance of the certified facility from 3 months to year to 1 year, submission of surveillance report to NHSRC for 2 subsequent years during this certification process. So these are the national quality certification process, where step 1 is receiving application, review by the national consultant and quality and patient safety division, assessment managed by the certification unit at NHSRC, which is deputing the particular assessor for the national certification, recommendation by MOHFW, and issue of certificate by the certification unit to the particular healthcare facilities. Virtual certification, that is one of the particular opportunity which I was mentioning regarding. This was approved in 28th June 2024 by the ministry, where the Ayushman Arogya Mandir, which are the major chunk of the healthcare facilities in the country. So this virtual assessment has been approved, where the facility can opt whether it want to go for the virtual assessment or the physical assessment, and documents are being reviewed at the particularly DQAC level, and applications are sent for the state and national certification, and these assessments are conducted virtually. Once the facilities are certified, out of the total virtually certified facilities in the state, 10% of the facilities go for the physical verification by the MOHFW, like the system is robust and particularly integrity of the assessment process has been maintained. So this is the initiative where I think the state can leverage upon how to uh, come up with the maximum facilities or Ayushman Arogya Mandir for the virtual NQAS certification. This is the particularly status till 31st October 2025 for the state of Maharashtra, where we have total 11,827 facilities, and only 2.27 facilities are NQAS certified. When we say NQAS certified, it includes both the national certified as well as the state certified facilities. We can see that around 152 facilities are state certified, but they have not come up for the national certification. Each level of facility, right from the district hospital, only one district hospital is national certified. So the target is lacking here also. Sub-district hospital 3, community health center 3, primary health center is a good, I will say, approach by the state, where the maximum number of primary health centers are coming for the NQAS certification. So 132 facilities are there, but still we are lacking in the achieving the target. That again require the efforts from the district and the state teams. Urban health facilities, we are around 5 facilities are national NQAS certified. Ayushman Arogya Mandir, where that is the maximum number of healthcare facility, 8,417 facilities, but till date only 125. That is only 1% of healthcare facility. Here I want to push that the state should prioritize these facilities for maximum certification, as virtual certification is also available for these healthcare facilities. Kayakalp, under Kayakalp, state is performing well. Around 2954 facilities are being nominated as the Kayakalp facilities in year 2024-25. So these facilities can also be particularly prioritized for the NQAS certification. So this is the entire NQAS overview regarding this particularly state of Maharashtra, where we can move ahead with the orientation on the Saksham portal, which sir has requested that some of the facilities are not able to uh, apply on the Saksham portal and delays are happening. So we can take up the next presentation on Saksham portal by Dr. Neeraj Gautam, senior consultant. Uh, Certification unit, quality and patient safety and HSRP. Dr. Neeraj, can you hear me?
Hello.
Hello.
Yes, please, you
Uh,
can continue with the next presentation.
right, sir. Right, sir. I'm just connecting with Dr. Neeraj so that we can start. हेलो हाँ जी शुरू कर दी क्यों अच्छा तो उस पर आपकी वो है स्लाइड्स है कर लो हेलो
कधी काही म्हणजे असं फोन लावतो साहेब त्या वेळेला जातात ते करतात तशी पण आपल्या त्यांच्याकडनं अपेक्षा
हम कुछ लोगों को डिलीट कर रहे हैं मैडम और उनको ज्वाइन होने को बोलो
Sorry for the inconvenience. I think it's reached maximum participation
Yeah. Welcome.
capacity.
Session.
That is why. Yes. That is why. But now he's coming here only and joining along with me. So just wait for a few seconds, and
Yeah,
he is
please.
here. Yeah.
Okay, good afternoon, everyone. Hope I am audible. Hello.
Yeah. You're audible,
Okay,
please.
thank you so much, sir. Okay, myself, Dr. Neeraj Gautam. I am working as a senior consultant in certification unit under QPS division.
Yeah,
Okay,
thank you for joining this session, and it's great that you are giving time for State of Maharashtra. So my team is connected through VC and on the YouTube also.
yes,
So
sir.
at present, around 1,200 people are connected from the field, from the district
Okay,
and child facilities. Thank you very much.
okay, okay. Thank you so much, sir. Naveen ji. Okay, I will be helping, telling you by demonstrating you about how to register and what is the process for submitting the application. And if anything else needed by you for support on Saksham, you may ask one by one after the session is over. Hope it is okay.
Session will take some questions from the field.
Huh, sure.
Yeah.
Okay, so hope the screen is visible to you.
Great.
Okay, and just log in into the Saksham website, that is Saksham.org.
The screen is now visible. Yeah. Your login.
Okay. Okay, when you just ping in with the page saksham.nhsrc.india.org, you will be having this request. This page will be landing up. You have to register first for your facility at any level of the facility you want to apply for. First is in the registration form will open. You will have to select the select type. Rather, you have been the facility in charge, SQAU, DQAU, and state nodal officer. Both the IDs have been created already, but at facility level, major of the IDs will not be there. So just click on the facility in charge. Then you have to select the state like Maharashtra we are getting. Then you have to district so just selecting the Ahmedabad district. Then you have to select the type of the facility, whether is this Ayushman Arogya Mandir, Community Health Center, Urban Primary Health Center, or whatever the facility listed amongst you. So I'm just picking it Ayushman Arogya Mandir Civil Center. Then you have to select the facility name, or just you have to type the NIN ID. When you type this NIN ID, you have to also enter the mobile number of the person facility in charge, maybe the CHO or the medical officer in charge, whoever is present in the facility, at depending upon the level of the facility is going to register. And you have to just enter the caption register. When you put the NIN ID, the name of the sub center or the facility will auto reflect it. Sometimes it happens, the problem we are facing that मेरा सब सेंटर जो है इस नाम से रजिस्टर्ड नहीं है, या मेरी CSC PSC हो गई है, या these challenges we are generally facing. So whenever you are registering through Indian ID, the notification pop-up will come, and if it differs from the Indian ID portal, then it will show you that your facility is registered as. So, just give an example. There is one CSC, but previously it was PSC and it has been upgraded to CSC. But it is registered as PSC on InPortal and it has not been updated by state. First thing is you have to get it updated on NID portal, and if there is some challenges, if still it's not possible, then you may apply at it under community health center. You will put the NID. If the NID is registered at PSC, it will Saksham will ask you whether the facility you are going to register is as registered as primary health center in Indian portal. You want to proceed, this notification you will get. If you click on OK, then it will get registered as PSC, but if you click cancel, then it will register at CSC level. So this is one of the notification will be coming. And finally, when the registration is over, then the approval, for approval it will go to DQAU or SQAU. DQAU in case of primary healthcare facilities like PSCs, UPSCs, and sub center. But if facility in charge from CSC and above facilities is registering, then the approval will be given by this state quality assurance unit. Hope this is clear till now. Okay, just now next is I'm about to give you the demo कि कैसे the facility has to proceed further. Just going it on UAT for this. Okay. After the registration, the facility has to log in here using the credentials they will get after the approval has been given from the appropriate authority. Again, I'm telling for primary health center, the approval will be given by district quality assurance unit. For a secondary level, the approval will be given by state quality assurance unit. Once you log in through after the approval for the facility login ID, this page will pop up and you have to complete the facility setup first. You have to go to the facility setup. You have to update the facility in charge details. Here, all the details you have to fill. That what is your mobile number? It's already been given when the registration has been done. And what you can also change the mobile number from here. If you want to change, you can just mobile number you have to change and you can update it further. If the facility charge is getting transferred or getting retired or whatever the changes in the system that facility in charge is changing, you may change the name and other details for facility in charges from there. Update facility in charge profile. After that, one option is facility department mapping master. There you have to map the departments you are going to apply for. For example, for sub center, it's now mandatory for 12 service packages. Then you have, because this page will go blank when you are register the new facility, you have to click map. It will show like this. All the packages will be reflecting on the left side of this column, like just so these are all mandatory. So you have to click, just have to click it, and this from left it will go for the right, and just have to submit it, and all the facility packages have been mapped. Similarly, you have to do it in case of PSC, CSC, and district hospital. In case of district hospital, where you do not have ICU or any other department, then you can skip that department and proceed with the applicable departments that are functional in the district level hospital or CSC or sub district hospital. Then there is the option of KPI details. They have to enter the KPIs for each level of each month. In this, you have to enter the in this sub center level. You just have to enter the PSS. So you just have to click on the month. You have to enter the PSS for last 3 months at least for applying for further for the application. Next is bed details. Bed details is not applicable in case of sub health center, but for other level of hospital you have to click add and you have to add the details कि कौन सा है. For this sub center level you need to check whether the facility is type A or type B. If the facility is type A where the delivery has not been conducted, then you have to select type A. If the facility is delivery point, you have to select as type B. After type B, you need to mention the number whether the facility has been conducting deliveries. Yes, तो कितना delivery वहाँ पे हो रहा है वो आपको यहाँ पे mention करना पड़ेगा. There is option कि type B में delivery हो रहा है कि नहीं हो रहा है, but it is mandatory कि करना ही करना है. तो for example, 12 deliveries have been conducted in the type B level. So then you have to click it here and you have to give कि कौन-कौन सी services हम दे रहे हैं, because it's been mandatory for all facilities की सारी facilities हमको देनी है services. तो इट इज हमारा यहाँ पे बेड डिटेल्स में आपको न्यू केसेस भी डाल सकते हो. फॉर एग्जांपल कि हमारा पर मंथ केस लोड होपफुली यहाँ पे 150 है, तो यू जस्ट हैव टू पुट इट हियर एंड फॉलो अप केसेस. द पीएसएस यू हैव एंटर्ड इज केपीआई डिटेल्स विद ऑटो रिफ्लेक्ट. यहाँ पे हमारा वैल्यू 3 मंथ्स का लास्ट कैलकुलेट होके आएगा. देन यू हैव टू जस्ट सबमिट एंड द एप्लीकेशन विल प्रोसीड फर्दर. आफ्टर दैट, once all the details have been entered, you just have to click on services. Then you have to create a new application like manage applications. You will create the new application. I have just created it recently for this demonstration only. So here you will see that all the details are here. Okay, just sharing another facility जिसमें अभी तक कुछ भी update नहीं हुआ है. So that will be helpful for you people कि कैसे हम इसको आगे proceed करेंगे. Like this is another fresh facility. इसमें अभी कोई भी काम नहीं हुआ है, तो इसमें you have to create the update facility in charge details. This has been selected. यहाँ पे सब कुछ details हमारी पड़ी हुई हैं. You just has to enter as because यहाँ पे हमारे जो facility in charge होते हैं वो CHO होते हैं. You just have to mention that यहाँ पे CHO is the in charge of the facility. This is community health officer. Just update it. ये अपडेट हो गया तो ये आपका यहाँ पे फर्स्ट दैट यू हैव अपडेटेड द प्रोफाइल. नेक्स्ट इज व्हाट आई एम टेलिंग अबाउट कैसे हमको डिपार्टमेंटल मैपिंग करनी है. तो मैप एंड अनमैप पे क्लिक करेंगे. ऑल द डिपार्टमेंट्स ऑलरेडी मैप्ड. यू जस्ट नीड टू सबमिट दिस फर्दर एंड इन केस ऑफ CSC PSC यू हैव टू क्लिक डिपार्टमेंट्स अकॉर्डिंग टू दी एप्लीकेबल या फंक्शनल डिपार्टमेंट इन हॉस्पिटल्स. KPI में सिमिलरली यू हैव टू fill it for 3 months like August. If their value is entered in as per the numeric like 80%, it will auto calculate it to 4% as 4 out of 5 on Likert scale as well. It is auto calculating. You just have to update the KPI detail for each month. For August, September and October at least we will be needing for 3 months. This is for last is for October. Just have to enter the value like 78. So updated KPI, you have to just update KPI. So these KPIs for last 3 months is updated. That is needed in the application. Now again, you go for the department details. Just add the department things. All the things will be there. Type A, type B है कि कितना है क्या नहीं है. And see what enter data we have entered is auto reflecting in PSS, auto calculated here at the end of the sheet 81.33. Just you have to submit this application. Now go to services. You have to create a new application for the assessment. Just click on create new assessment. Now you'll be see that यहाँ पे ही आपको select करना है whether you want to go for the virtual or physical assessment. In case of sub center, in other cases there is no option for virtual, so you have to go with the physical assessment. For example, you are going for the virtual assessments. All the department 14 packages have been mapped already. Just submit this application. This has been created. Now you have to proceed further to submit all the documents. Now first is document mapping, that departmental mapping, that is already been done. You have to save and proceed further. यहाँ पे आपको अलग अलग लेवल के असेसमेंट रिपोर्ट्स चढ़ानी होंगी, लाइक दिस रिपोर्ट टाइप. फॉर एग्जांपल इंटरनल असेसमेंट रिपोर्ट, जो भी आपकी फैसिलिटी ने इंटरनल असेसमेंट रिपोर्ट की हुई है, कौन सी डेट की है. फॉर एग्जांपल 1 नवंबर. यू जस्ट हैव टू एंटर द स्कोर ऑफ 78%. देन यहाँ पे यू हैव टू अपलोड द एक्सेल शीट वट एवर इज, जो भी आपका रिपोर्ट होगा आपके लेवल पे, तो वो यहाँ पे आपको चढ़ा देना है. क्रिएटिंग इट फॉर यू. I just putting it, similarly submit करेंगे उसको. Then you can add the other district level report similarly, कब डेट पे हुआ. फॉर एग्जांपल 7 नवंबर को हमने किया, उसका रिपोर्ट वैलिड डेट 7 नवंबर से है. कब तक वैलिड डेट इज शोइंग फॉर 1 ईयर. आपका स्टेट डिस्ट्रिक्ट पे स्कोर 81% था. यहाँ पे भी आपने जो अभी आपका डिस्ट्रिक्ट लेवल का स्कोर होगा वो आपने चढ़ा दिया. And similarly you have to put it for state level assessment or state level validation score, whatever you are just proposing it. तो यहाँ पे SQA की assessment report भी हमको चढ़ा देनी है with the score कि कब से valid है SQAU की रिपोर्ट. और यहाँ पे हमारे स्कोर फॉर एग्जांपल इट्स 79% स्टेट पे आया था, तो यहाँ पे भी हमको रिपोर्ट फाइल इसकी हमने एडिट कर दी. And just need to submit it finally. Then this all the reports have been submitted. Now you have to proceed further, save and proceed. Next is you have to conduct कि फिर यहाँ पे आपको ऑप्शन चेंज करने का मिलेगा, वेदर टाइप ए टाइप बी आपको रीवेरीफाई करना है कि हो रही है कि नहीं हो रही है. इन केस फॉर एग्जांपल आपकी फैसिलिटी ड्यूरिंग द एप्लीकेशन आपने गलती से उसको टाइप ए कर दिया, यू वांट टू चेंज इट टाइप बी, और टाइप बी था तो यू वांट टू चेंज इट टाइप ए, तो यहाँ पे फाइनल आप इसको सेव प्रोसीड कर सकते हैं. एंड ऑल्सो इफ वहाँ पे आपने केपीआई अपडेट नहीं किया तो प्रीवियस पेज पे भी आपके पास ऑप्शन आएगा अपडेट केपीआई का, दैट यू कैन डू. और फाइनली यहाँ पे आपकी सारे डिटेल्स जो भी आपकी एप्लीकेशन फॉर्म है वो अपडेट साइन करा करके ऑल दी डॉक्यूमेंट्स दैट इज नीडेड फॉर द असेसमेंट यू हैव टू अपलोड इट. क्लिक ऑन यस, जो जो आपने सबमिट किया यू हैव का प्रोफाइल जो भी आपकी डॉक्यूमेंट उनके बिहाफ पे दैट यू कैन अपडेट एंड जस्ट ड्राफ्ट सेव एंड फाइनली सबमिट इट. जब आप सबमिट करेंगे फाइनल एप्लीकेशन, देन इट विल बी गोइंग टू फर्दर टू डिस्ट्रिक्ट क्वालिटी एश्योरेंस यूनिट फॉर फर्दर प्रोसेसिंग. एंड जस्ट शोइंग कि DQAU पे आपको कैसी प्रोफाइल डिस्ट्रिक्ट लेवल पे दिखेगी वंस द एप्लीकेशन हैज बीन रिसीव्ड बाय यू. दिस इज द डिस्ट्रिक्ट लेवल प्रोफाइल. यहाँ पे आप देखोगे HR मैनेजमेंट को ऑप्शन भी हमारे पास है. यहाँ पे फैसिलिटी इंचार्ज मास्टर की लिस्ट आएगी, जो भी आपके अप्रूवल पड़े होंगे यू कैन जस्ट गिव द अप्रूवल फ्रॉम प्रोविजनल यूजर लिस्ट. जो भी आपके पास फैसिलिटी रजिस्टर करेगी यहाँ पे आपके अप्रूव कर सकते हो. सिमिलरली आपके पास एक मास्टर प्रोफाइल भी दी हुई है फैसिलिटी इंचार्ज मास्टर की, वेयर यू कैन एडिट द डिटेल्स इफ यू वांट. कि फॉर एग्जांपल किसी का फैसिलिटी इंचार्ज चेंज हो गया है तो यहाँ से भी आप डिस्ट्रिक्ट लेवल पे उसको मॉडिफाई कर सकते हो. फॉर एग्जांपल यहाँ पे आप मॉडिफाई किया एंड यू कैन चेंज द नेम एंड प्रोफाइल ऑफ द असेसर, जो भी आप चेंज करना चाहो. इन केस देयर इज एनी ट्रांसफर और चेंज ऑफ द इंचार्ज, तो यहाँ पे आप वो भी चेंज कर सकते हो. आफ्टर दैट इफ यू गो टू द सर्विसेज तो मैनेज एप्लीकेशन पे जाएंगे तो ये कैन सी दी एप्लीकेशन जो हमने अभी क्रिएट की थी वो यहाँ पे पड़ी हुई है, तो यू कैन जस्ट रिसीव इट फर्दर। और अगर आपके यहाँ डिस्ट्रिक्ट क्वालिटी एश्योरेंस यूनिट पे कोई भी नहीं है तो आप स्टेट की प्रोफाइल पे जा करके आप उसको पुल भी कर सकते हो। ऊपर मैं आपको भी एक बार दिखा देता हूँ प्रोसीडिंग इट फर्दर, क्योंकि फिर एक बार डिस्ट्रिक्ट पे आ गई तो यू कैन प्रोसीड, उसको भी आप प्रोसीड कर सकते हो। कैसे आप फॉर एग्जांपल आपके डिस्ट्रिक्ट अहमदनगर में कोई भी डिस्ट्रिक्ट कंसल्टेंट नहीं है एंड यू हैव टू मूव द एप्लीकेशन टू नोडल ऑफिसर लेवल, तो वो भी आप कैसे आप इसको प्रोसीड कर सकते हैं डिस्ट्रिक्ट। सिमिलरली यहाँ पे स्टेट की प्रोफाइल पे भी हमने आपको फैसिलिटी इंचार्ज मास्टर, डीक्यूयू मास्टर, आरक्यू मास्टर दे रखा है। इन केस कहीं भी आपका डिस्ट्रिक्ट क्वालिटी एश्योरेंस का कंसल्टेंट चेंज होता है या रीजनल कंसल्टेंट चेंज होता है तो देयर यू कैन चेंज द नेम फॉर दैट लेवल एज वेल। आप यहाँ पे भी अप्रूवल दे सकते हो फॉर सीएससी एंड कॉलेज और डीएच की जो भी आपके पास आएंगी रिक्वेस्ट रजिस्ट्रेशन की, वो आप दे सकते हो। यहाँ पे आप देखोगे तो आपके पास भी मैनेज एप्लीकेशन का ऑप्शन है। यहाँ पे आपको होल्ड कैंसिल असेसमेंट का भी ऑप्शन आता है, बट इट है जब तक ये एप्लीकेशन आपकी स्टेट लेवल पे है तब आप उसको होल्ड कैंसिल कर सकते हो। वंस इट हैज बीन मूव टू नेशनल लेवल। हेलो हेलो ओके सी यहाँ पे आपको स्टेट की प्रोफाइल पे पुल रिक्वेस्ट का ऑप्शन मिल रहा है। अगर आपके डिस्ट्रिक्ट कंसल्टेंट पे काम नहीं हो रहा है तो डायरेक्टली आप स्टेट पे एप्लीकेशन को पुल भी कर सकते हो। आफ्टर दैट आई एम कमिंग बैक टू द डिस्ट्रिक्ट कंसल्टेंट प्रोफाइल। डिस्ट्रिक्ट की प्रोफाइल पे आप जाएंगे तो यहाँ पे रिसीव रिक्वेस्ट का ऑप्शन है। आपने रिसीव कर ली रिक्वेस्ट, यस, तो ये आपके पास तो यहाँ पे आपको प्रोसीड कर देना है फर्दर। यू जस्ट नीड टू चेक कि वेदर जो भी आपकी फैसिलिटी ने डॉक्यूमेंट्स चढ़ाए हैं आप यहाँ पे रीवेरीफाई कर सकते हो उसको कि उसने डिटेल्स जो ठीक दी हैं कि नहीं दी हैं। यहाँ पे आप देखोगे डीक्यूए की असेसमेंट रिपोर्ट चढ़ी हुई है। अगर आप चाहो तो स्टेट की रिपोर्ट यहाँ पे चढ़ा सकते हो। वैसे डिस्ट्रिक्ट की रिपोर्ट डिस्ट्रिक्ट पे ही चढ़ेगी, फैसिलिटी पे नहीं चढ़ती है। इन केस द एप्लीकेशन हैज बीन क्रिएटेड बाय डिस्ट्रिक्ट तो डिस्ट्रिक्ट की रिपोर्ट वहाँ पे भी चढ़ा सकता है। ये मैंने ऑलरेडी चढ़ा दी थी फैसिलिटी की प्रोफाइल से, तो यहाँ पे नहीं तो ऑप्शन आता है आपके पास कि आप कैसे डिस्ट्रिक्ट की रिपोर्ट चढ़ा सकते हो। डिस्ट्रिक्ट लेवल पे डिस्ट्रिक्ट की रिपोर्ट चढ़ेगी, देन यू हैव टू सेव एंड प्रोसीड फर्दर। यहाँ पे अगर आपको लगता है कि फैसिलिटी ने एंटर गलत किया है तो यहाँ पे भी आपके पास ऑप्शन है इसको चेंज करने का कि आप टाइप बी टाइप बी में चेंज कर सकते हो एट दिस लेवल ऑल्सो। और ये ऑप्शन आपके पास स्टेट पे भी आता है और आपके पास स्टेट नोडल ऑफिसर की प्रोफाइल पे भी आता है। बट द एप्लीकेशन वंस हैज बीन देयर फॉर आपकी वर्चुअल असेसमेंट के लिए एक बार चढ़ गई है तो वो मैनुअल आपको यहाँ पे आप चेंजेस नहीं कर सकते हो। दैट हैज टू बी डिफाइंड एट द फैसिलिटी लेवल ओनली कि आपको वर्चुअल के लिए जाना है कि फिजिकल के लिए जाना है। अगर आपको तब भी लगता है कि आपने एप्लीकेशन गलती से फिजिकल के लिए चढ़ा दी है बट यू वांट टू गो फॉर द वर्चुअल असेसमेंट, आप यहाँ से अपनी एप्लीकेशन को कैंसिल कर सकते हो, फिर न्यूली नए तरीके से आप उसको सबमिट भी कर सकते हो। यहाँ पे सेव एंड प्रोसीड किया, सेव एंड प्रोसीड किया, यहाँ पे आपका डिलीवरी आपने चेक कर लिया सब ठीक है, चढ़ा हुआ है। डॉक्यूमेंट्स आपने देख लिया सब ठीक चढ़े हुए हैं कि नहीं चढ़े हुए हैं, देन यू हैव टू गिव द अप्रूवल इट फर्दर। यहाँ पे आपने अप्रूव कर दिया इसको, ड्राफ्ट सेव कर दीजिए, भेज दीजिए आगे अगले लेवल पे और फाइनली आप इसकी एप्लीकेशन सबमिट कर देंगे तो ये आपकी स्टेट लेवल पे प्रीव्यू कर सकते हो। यहाँ पे भी यू कैन सी एक बार आप फिर से अगर आप रिव्यू करना चाहो, फाइनली एक्सेप्टेड, सेंड इट टू नेक्स्ट लेवल। जब आप इसको नेक्स्ट लेवल पे सबमिट करोगे तो एसक्यूए के पास पे चली जाएगी विच वी आर हैविंग दैट। पहले आपको फुल रिक्वेस्ट का ऑप्शन दिख रहा था क्योंकि आपके पास डिस्ट्रिक्ट कंसल्टेंट इन केस नहीं था, बट डिस्ट्रिक्ट कंसल्टेंट ने आगे मूव कर दी तो यहाँ पे रिसीव रिक्वेस्ट आप करोगे कि आपके पास डिस्ट्रिक्ट से स्टेट पे रिक्वेस्ट आ गई है और आप उसको प्रोसीड फर्दर करोगे। देन अगेन यू विल कैन वेरीफाई स्टेट लेवल ऑल्सो कि भैया कुछ इसमें चेंजेस करने हैं तो हम कर ले। अनटिल अनलेस दी आप फिजिकल मतलब असेसमेंट मोड नहीं चेंज कर सकते हो। खाली यहाँ पे आप अपने स्टेट क्वालिटी एश्योरेंस यूनिट की रिपोर्ट चढ़ा सकते हो कि जो भी आपके स्टेट असेसमेंट हुआ था उसकी रिपोर्ट आप यहाँ से भी चढ़ा सकते हो इस लेवल पे आ करके। एंटर स्कोर हमने 79% किया, यहाँ पे एक प्रोफाइल पे फाइल हमने ऐड कर दी तो स्टेट की रिक्वेस्ट भी यहाँ पे ऐड हो गई कि स्टेट की हमारी जो रिपोर्ट थी वो फाइनली यहाँ पे ऐड होके आ गई। इसको फाइनली सबमिट कर दीजिए तो देन यू कैन सी कि यहाँ पे आपको स्टेट क्वालिटी एश्योरेंस यूनिट की रिपोर्ट भी आपको दिख रही है। देन यू विल प्रोसीड इट फर्दर। ऑल रिपोर्ट फाइल्स, यहाँ पे आप देखोगे तो एक इंटरनल की फाइल मिसिंग है। यहाँ पे आपको इंटरनल असेसमेंट की रिपोर्ट भी आपको चढ़ानी पड़ेगी। अभी सब चढ़ गई हैं तो यहाँ यू कैन सेव एंड प्रोसीड फर्दर। और अपलोड रिपोर्ट फाइल, तो यहाँ पे आप देख रहे हो कि डिस्ट्रिक्ट क्वालिटी एश्योरेंस की रिपोर्ट नहीं चढ़ी हुई है, तो यहाँ पे आपको डिस्ट्रिक्ट क्वालिटी एश्योरेंस को भी चढ़ा करके फाइनल्स को सबमिशन करना पड़ेगा। सेव एंड प्रोसीड, ये आपकी आगे प्रोसेस होगी नेक्स्ट लेवल पे। तो यहाँ पे आपने चेंजेस चेक कर लिया, वेदर दे विल बी अप्लाइंग फॉर इट। यहाँ सारे डॉक्यूमेंट्स आपने भी वेरीफाई कर लिए, यहाँ पे आपने स्टेट लेवल से अप्रूवल दे दिया, अप्रूव्ड। देन ये आपकी नेक्स्ट लेवल पे चली जाएगी नोडल ऑफिसर पे, और नोडल ऑफिसर उसको आगे प्रोसीड कर देगा फर्दर। यहाँ पे आपको देखोगे तो आपके पास एप्लीकेशन रिक्वेस्ट भी आ गई कि जीएसटी को जो हम लोग एप्लीकेशन देते हैं, यू कैन चेक कि हमारे पास इतना स्कोर आया, एसक्यूएसी की तरफ से आपने इसको प्रोसीड कर दी, एंड फाइनली एक्सेप्ट इट इन नेक्स्ट लेवल। तो ये फाइनली आपके पास एप्लीकेशन के बाद नेक्स्ट लेवल स्टेट नोडल ऑफिसर पे जाएगी, जिससे आप एप्लीकेशन आगे प्रोसीड कर सकते हो फर्दर कि हम इसको नेशनल लेवल पे भेज रहे हैं। अगर आपको कोई भी रिवर्सल करना है तो आप रिवर्सल भी कर सकते हो डॉक्यूमेंट्स। तो आप देखोगे तो हमारा जो एप्लीकेशन था आर्मी टर्ना का, तो हमारे पास डॉक्यूमेंट पे यहाँ पे चेकलिस्ट पे जब हम डॉक्यूमेंट वेरीफाई कर रहे थे, आपको लगता है कि कोई डॉक्यूमेंट ठीक नहीं है, तो आप इसको डिस्ट्रिक्ट लेवल या फैसिलिटी लेवल पे रिवर्ट भी कर सकते हो कि इस डॉक्यूमेंट को ठीक से चेंज करके भेज देगा। वंस दिस हैज बीन डन, मैनेज एप्लीकेशन में आपके पास यहाँ पे जब आपको फिर सिमिलरली डॉक्यूमेंट वेरिफिकेशन विल बी डन एट नेशनल लेवल। वहां पे भी हो सकता है कि कंसल्टेंट को लगे कि ये डॉक्यूमेंट गलत है, पुराना है, तो वो आपको डॉक्यूमेंट रिवर्ट कर देगा। देन यू कैन एंड ही विल आस्क कि आपको ये कैसे चेंज करके क्या आपकी रिक्वायरमेंट है हमारी, तो आप उस रिक्वायरमेंट के बेस पे अपने डॉक्यूमेंट फ्रेशली अपलोड कर सकते हो। वंस it has been documents have been verified and duly approved, the application will move further to the next level at certification unit। वहां पे आपको असेसमेंट की डेट्स दी जाएंगी। आपको असेसमेंट की जब डेट मिलेगी तो यू कैन सी कि आपको असेसमेंट की डेट मिली हुई है, डेट प्रपोज फॉर द असेसमेंट एंड सेंड टू फैसिलिटी फॉर रिसीव पेंडिंग। तो यहाँ पे आप क्लिक करोगे एक्शन के पार्ट में, तो यू विल सी कि आपको यहाँ पे दो ऑप्शन दिखेंगे, एप्लीकेशन असेसमेंट शेड्यूल का, व्यू एप्लीकेशन के। यू जस्ट नीड टू क्लिक एट असेसमेंट शेड्यूल, यहाँ पे जो आपकी डेट्स मिली होंगी आप उसको एग्री कर सकते हो, यू कैन एग्री इट। और आपको नहीं करना है तो रीशेड्यूल डेट पे ऑप्शन क्लिक करोगे, ऑप्शन की कौन सी आपको, मान लेते हैं आपको 26 नवंबर को असेसमेंट या दिसंबर में 5 तारीख को नहीं कराना है, आपके यहाँ कोई छुट्टी है या कुछ भी है, तो यू कैन जस्ट शेड्यूल एक आप अपना ऑप्शन दे सकते हो कि मुझे इस डेट पे ना करा करके दूसरी डेट पे कराना है फॉर एग्जाम्पल। बट इसमें आपको मोर देन 15 डेज का ऑप्शन नहीं आएगा रीशेड्यूलिंग के लिए। मतलब मान लेते हैं हमने आपको अगर 5 दिसंबर की डेट दी है, तो यू कैन ask the time for maximum of 15 days, इससे ज्यादा टाइम हम नहीं दे सकते, you need to cancel the application due to any other reason, and similarly you can give the dates। तो अगर आपको ठीक है, आपको लगता है कि हमें ऑप्शन हम अपना असेसमेंट इस डेट को करवा लेंगे, तो यू कैन जस्ट यहीं पे आप उसका आई एक्सेप्ट कर दोगे तो एप्लीकेशन आपकी फर्दर पहुंच जाएगी। देन दी अदर प्रोसेसेस ऑफ एप्लीकेशन हैज टू बी, फिर हम एफएसआर डिप्यूट करके उस असेसमेंट को करा देंगे, एंड फाइनली द रिजल्ट जब डिक्लेयर होगा तो यहाँ पे आप उसका फैसिलिटी का रिजल्ट भी आप देख सकते हो अपने यहाँ पे, स्टेट पे भी, डिस्ट्रिक्ट पे भी और फैसिलिटी पे क्या रिजल्ट आया, समरी रिपोर्ट क्या थी, साइन रिपोर्ट, एवरीथिंग यू कैन सी हियर। दिस इज ऑल अबाउट दी ऑल द 3 प्रोफाइल्स या मॉड्यूल्स जो हमने अपने डेवलप किए हैं। एंड ओके, नाउ आई एम stop sharing the presentation. This is all about the how the application process will flow from facility level to state level and national level. Hope everything is clear from my side. I think अगर कोई भी आपके क्वेश्चंस हैं तो सर वन बाय वन यू कैन आस्क मी एंड आई विल try to resolve each and every query possible. Thank you so much.
तुम्ही हँड रेज करा. Particularly, I will ask the district teams if you have any queries. Dr. Naveen Kumar sir is available. So
Hopefully the presentation जो मैंने किया सर, डेमो दिखाया, वो एक एक पॉइंट को कवर किया, कोई चीज मिस हो गई तो आप प्लीज पूछ सकते हैं.
yeah. And Neeraj sir is also available. Please, anybody having any queries, you can ask. You can raise your hand. From the
आप सर अपनी क्वेरी चैट बॉक्स में भी लिख सकते हैं, हम चैट बॉक्स से भी आपको इसको
please
रिप्लाई करने की
write the
कोशिश
chat box and raise your hand rather than talking.
यस आप चैट बॉक्स पे लिख दीजिए, हम वन बाय वन उसको क्वेरी को रिजॉल्व करने की कोशिश करेंगे।
Yeah, please. So all the district level and the facility level team, so kindly put your queries in the chat box so that you can answer it. And if no queries means all the concepts are clear, and now we expect that within a week, maximum facility should.
Okay, one person sir have asked that do HBT needs NQAS registration? What is HBT first? I need to ask you, sir.
So that is a Hindu Hriday Samrat Balasaheb Thackeray Apla Davakhana. That's a state level activity actually.
Okay, so
The
NQAS.
Apollo Clinic in Delhi.
Okay, just I would like to suggest इसमें what is there is हमारा जो target आज की डेट में है that is confined to district hospitals, CSC, sub district hospitals, PSC, UPSC and sub center. If this HBT falls under sub center, इसका कोई हमारे पास टूल मेरे हिसाब से अप्रूव टूल नहीं है कोई भी असेसमेंट कराने के लिए, बट अगर इसका स्कोप ऑफ सर्विसेज सब सेंटर लेवल की तरह चल रहा है तो यस इट कैन अप्लाई फॉर NQAS सर्टिफिकेशन। बिकॉज सिमिलरली सर दो तीन इश्यूज हम लोग क्या डिफरेंट स्टेट से भी आए हैं, लाइक बस्ती दवा खाना चलता है तेलंगाना में एंड रूरल डिस्पेंसरीज गोवा में, तो इफ दे फॉल अंडर PSC और सब हेल्थ सेंटर यस दे कैन अप्लाई फॉर NQAS सर्टिफिकेशन। एंड सर सॉरी टू से बट NQAS रजिस्ट्रेशन नहीं है, इट इज NQAS सर्टिफिकेशन, यू हैव टू रजिस्टर फॉर फैसिलिटी फॉर NQAS सर्टिफिकेशन। एनी अदर क्वेरी सर? Okay.
So want to talk?
NQAS certification is only for no sir, NQAS certification is mandate for each and every level of hospital from primary from sub health center जो हमारा सबसे lowest part है till maximum secondary care hospital that is district level hospital, तो हर level पे हमारे NQAS certification होता है। NQAS certification for sub center is you can apply in virtual mode or in physical mode। स्टेट सर्टिफिकेशन जो भी होगा वो सब सर आपका फिजिकल लेवल की चेकलिस्ट पे होगा, वो वर्चुअल असेसमेंट की चेकलिस्ट पे नहीं होगा, बिकॉज वी विल बी हैविंग दिस, क्योंकि कभी कभी होता क्या है कि वर्चुअल पे हमने असेसमेंट किया बट हमारे नेटवर्क इश्यूज की वजह से वर्चुअल सर्टिफिकेशन पे उसको आगे नेशनल लेवल सर्टिफिकेशन नहीं करा पाए, तो फिर वो फिजिकल लेवल पे आपके यहाँ होगा। तो जितने भी स्टेट असेसमेंट हो आपके यहाँ सर्वे सेंटर पे प्लीज उसको नॉर्मल जो चेकलिस्ट है वर्चुअल चेकलिस्ट ना यूज करते हुए नॉर्मल सर्वे सेंटर की चेकलिस्ट पे यूज करें जी। तो NQAS सर्टिफिकेशन फिर इज फॉर ऑल द लेवल ऑफ हॉस्पिटल। Okay, hope I'm clear with the presentation, and if there are any queries you are facing during the routine activities, you may write a mail to Naveen and he will hand it over to the request to me and for further resolving the issues।
Yeah.
मेरे हिसाब से
and Naveen ji, thank you very much. Now I think my team is having all the concepts very clear with such a good session. So we hope again. Any more question is there? वुमेन
हॉस्पिटल भी NQAS करवा सकते हैं सर। डिस्ट्रिक्ट हॉस्पिटल के आपके वुमेन हॉस्पिटल की कस्टमाइज चेकलिस्ट है, उस पे स्टेट असेसमेंट कराइए। एंड नाउ द सूनर वी आर गोइंग टू इंटीग्रेट लक्ष्य मुस्कान अंडर NQAS, तो वी विल बी एक्सेप्टिंग द सिंगल एप्लीकेशन ओनली। कोई भी हम अलग से प्रोग्राम नहीं चलाएंगे लक्ष्य और मुस्कान का। तो किसी को अगर लक्ष्य और मुस्कान के लिए अप्लाई करना है तो इट हैज टू बी अप्लाइड थ्रू NQAS। नोट जा चुका है अप्रूवल के लिए मिनिस्ट्रियल CQSC। इफ यू फाइंड चेक दी CQSC मिनट्स ऑफ लास्ट 11 CQSC जो हमारी हुई है उसमें अप्रूव्ड हो चुका है कि इंटीग्रेट होके ही हम एप्लीकेशन रिलीज मतलब एक्सेप्ट करेंगे। एंड यस द एप्लीकेशन जो भी अब आएगी वी विल बी शेयरिंग अ फॉर्मल लेटर फ्रॉम ड्यूली साइंड बाय आवर मिशन डायरेक्टर ASMD सून। इट इज अंडर प्रोसेस, यस इट विल बी डन सून। तो जो भी आप लोग स्टेट असेसमेंट करोगे अब, तो प्लीज लक्ष्य मुस्कान के अलग से ना करके कंप्लीट एनक्वास का ही करिए।
ऐकलं का सगळ्यांनी?
सर सिव्हिल सर्जन सातारा बोलतोय.
यस सर प्लीज टेल।
हा बोला प्लीज.
एसडीएच 100 बेडची चेकलिस्ट होत
टॉक
नाही.
इन हिंदी और इंग्लिश प्लीज फॉर द कंफर्ट.
सर इट्स अवेलेबल इन इंग्लिश, कंप्लीटली इंग्लिश में अवेलेबल है चेकलिस्ट। हिंदी में चेकलिस्ट सिर्फ सब हेल्थ सेंटर के लिए ही अवेलेबल है, बाकी सारी टूल किट्स हमारी इंग्लिश में अवेलेबल है वेबसाइट।
इंग्लिशमध्ये.
डेडिकेटेड वुमेन हेल्थ चेकलिस्ट, वुमेन हॉस्पिटल चेकलिस्ट इज अवेलेबल विद स्टेट, उन्होंने कस्टमाइज कराई हुई है। प्लीज आप स्टेट से, स्टेट लेवल पे सर उसको आप चेकलिस्ट ले सकते हो।
मागवून घे.
येस.
अर्बन HWC के लिए सर अभी स्टैंडर्ड्स डेवलप हो रहे हैं, उसकी कोई टूल किट हमारे पास अवेलेबल एज सच नहीं है, बट सून विल बी गोइंग टू लॉन्च विद द अर्बन HWC। और अर्बन HWC एज सच हमारे जो सब सेंटर आज की डेट में कोटेड हैं टारगेट के लिए, दैट इज 1,68,000, उसमें अर्बन हेल्थ वेलनेस सेंटर नहीं आते हैं। विवेक पुकले इज आस्किंग प्लीज एक्सप्लेन द प्रोसीजर ऑन अगेन। सर क्या प्रोसीजर जानना है विवेक जी? रूरल RRSH इज आई थिंक रूरल हॉस्पिटल्स, रूरल हॉस्पिटल की चेकलिस्ट भी आपके यहाँ CSC की लेवल पे चलती हैं, तो सारी की सारी चेकलिस्ट CSC लेवल पे हैं। होप रूरल हॉस्पिटल इज कंसिडर्ड एज स्कोप ऑफ सर्विसेज फॉर CSC, क्योंकि पहले डॉक्टर चिन्मयी देखती थी जब, तो शी हैज टोल्ड मी कि CSC पे ही इसको चलना है। पोर्टल प्रोसीजर सर शायद इसकी हमने लाइव स्ट्रीमिंग यूट्यूब पे कर रखी है, तो यूट्यूब का लिंक हम आपके साथ शेयर कर देंगे, तो आप उसको बार बार जब भी चाहें देख सकते हैं। PPT will be shared by Naveen with the state, and the state is requested to share the PPT with the district level hospitals. You do not have blood storage unit at CSC level, you can apply, you can skip this department as, because अगर आपका BSU नहीं है तो आपका मतलब वो FRU नहीं होगा, that might be a non FRU CSC, तो आप उसको एज नॉन FRU CSC विद 8 या 9 डिपार्टमेंट जो भी एप्लीकेबल है उसके हिसाब से अप्लाई कर सकते हैं। वेयर टू सी कायाकल्प चेकलिस्ट, कायाकल्प चेकलिस्ट के नवीन आपको रिक्वेस्ट है नवीन से कि नवीन विल शेयर दिस डिटेल्स। Checklist for UPSC is available on website. You can go to QPS microsite ups.nhsrcindia.org. वहाँ पे आपको चेकलिस्ट सारी की सारी ऑल लेवल ऑफ हॉस्पिटल्स की मिल जाएंगी। Okay, now I am handing over to Naveen. Naveen will be handling the queries. If any of the queries for certification unit is considered, please let me know. Naveen will hand it over to me, and I will surely resolve it. Thank you so much. Thank you, sir. Thank you so much. Naveen, please.
Good afternoon again.
We have asked them to put in chat box, and some of the queries have been answered.
Yes, sir.
Any DQC, any officer want to have any question? The experts from the NHSRC are available. You can talk with them.
सर नमस्ते, बात कर सकता हूँ सर?
हाँ बोलिए, अंकारे जी बोलिए।
सर एक सबमिशन था अपने अभी जो आयुष्मान आरोग्य मंदिर जो है आम आयुष, वो इसमें एनक्वास में नहीं है। हमारे डिस्ट्रिक्ट में टोटल 25 आयुष डिस्पेंसरी है, उसमें से आम आयुष अभी 13 है, तो वो भी ले सकते हैं सर?
यस सर, ऑब्वियसली ले सकते हैं। आयुष्मान आरोग्य मंदिर की
कोई डायरेक्शन या गाइडलाइन नहीं है सर, उसका चेकलिस्ट या सब? अगर
आयुष्मान आरोग्य मंदिर की चेकलिस्ट सर अवेलेबल है अलोंग विद द गाइडलाइंस। द गाइडलाइन वाज इशूड।
सर आयुष्मान आरोग्य मंदिर PSC आम PSC आप सब सेंटर है आम आयुष।
आम आयुष का अभी सर कोई इस तरह का असेसमेंट टूल नहीं है, बट जो दैट इज नॉट इन आवर परव्यू, दैट इज अंडर द मिनिस्ट्री ऑफ आयुष।
यूपीएससी हम लोगों ने लिया है सर।
हाँ, यूपीएससी यू कैन टेक एज वेल एज PHC and Ayushman Arogya Mandir sub health centers.
Yes.
So respected DH sir, after this meeting I should highlight some of the points which can be taken up in the state level.
Please.
Yes. So looking at this NQAS framework and opportunities available with the state of Maharashtra, as we have to push further, and we have to put a lot of effort. You can see that 2.27 facilities are only percentage of facilities are certified, and target is 50% by like next month we are coming up. So I request that district and block level target should be given, and direction should go from the state level, that each state or each block should map the facilities, prioritize the facilities. Like I'm giving the example of other state how they are doing. Basically, for the Ayushman Argya, the number of facilities are very large. So you have to give some targets to block level officers and the district level officers where DQSC are functional. And DQSC should take the monthly review effectively and prioritize the facilities. Like if in any district, if there are 8 to 10 blocks, then each block can come up with at least one facility each month. So if we monthly take the 10 facilities from each district, it will go around 360 facilities from the each district every month. Such kind of target should be given to the block units and the district units. Block units particularly for the Ayushman Argya and district DQSCs and DQAU particularly for the entire district for all level of healthcare facilities. Secondly, I request you to kindly effectively utilize the pool of national assessors, external assessors which are available in your state, as well as the internal assessor, and a, good number of TIS professionals which are doing the PGDM on the basis of uh, state promoted, state sponsored candidate. They should be empaneled, and a mentorship program should be available for each district. Like in each district, you can map how many of internal assessor available, external assessor available, and TIS professionals assessor. They should do the capacity building of the particularly facilities which are being identified or prioritized for the NQAS certification. They should be given responsibility. Like some of the states are, these directions are issued by some of the states. Like if you have to do at least this much number of like 5 state assessment, then you go for one national assessment. Such kind of directions should be go from the state or DHS level, so that these pool can be effectively utilized, so that they first handle their own state, own district, own health facilities. Then they go for other state and assessments. Secondly, SQAC and DQAC should be strengthened. SQAC meetings are, as I got information from the last colleague, that these are not happening biannually, and uh, effective directions are not going. So these should be strengthened at the state level as well as the DQAC level. And HR requirement should be fulfilled, because for the effective implementation of program, you require the sufficient number of HR at each level, so that these things can be implemented. Virtual assessment of armed subcenter is a good opportunity. I am still seeing that very less facilities, less armed subcenter are coming for the virtual assessment. This should be prioritized and taken as an opportunity, that how we can push for the virtual assessment, along with the, like the national level, it is the 10% verification of these, physical verification of these facilities mandated. So this opportunity has to be utilized. So it is always that once the facility is state certified, the facility has 6 months time to apply for the national certification, where we can prepare the facility. So maximum facilities if can be enrolled for the state certification. Secondly, for the basically for the Ayushman Arogya Mandir Sub Health Center, we are every month we are organizing a NQAS implementation webinar from the national level on every second and fourth Friday. Like today it is planned, though it is Thursday, but it is planned, uh, and the timing is from 2 to 4. So the CHO level or facility level ANM or the district level facilities can join this webinar and there should be a direction going to from the state level, DHS level, that these webinar must be attended by all the facility level staff to orient them regarding the NQAS program and certification. Like today's talk is regarding the documentation requirement at the Arm Sub Center for the NQAS certification, work instruction requirement at the Arm Sub Center. So these are elaborate sessions. PPTs of these sessions are uploaded on the NQAS, this NHSRC website, where they can be used anytime. If the staff want to use them or see these videos are available on NHSRC website. These should be effectively utilized, basically for the Ayushman Argya sub-health centers. Kayakalp, I have also mentioned, the Kayakalp winner facility should be prioritized for the NQAS state certification and national winner facilities in next 3 months. Secondly, as our discussion on 20th November, we have discussed that the state certification is always a 5% score is less compared to the national certification. Like if we are asking for 70% score at the national, we give relaxation of 5% score. Like the facilities, if achieving 65%, they can also apply for the national certification. So these criteria and these rules should be effectively implemented, and the state team, district team should be well appraised regarding these guidelines. These are available in Operational Guideline 2021, and standards are available for all level of facilities and NQAS 2020 guidebook. They should be well versed regarding these guidelines and the rules, which can be effectively utilized. And as Dr. Neeraj has said that soon we are integrating this Lakshya and Muskan with single NQAS certification. So these things have been explained, and I think the wider message has gone to the all participants in this meeting that there is no escape way. We have to put all the efforts right from the national, state, and facility level to achieve these targets. So I request DHS sir to kindly give this direction from his level also, and state team should ensure that whatever facilities are coming for the NQAS certification should effectively reach for the national certification. There should not be any kind of barrier or obstacles in these applications, because target is very near. In next month we have to be 50%, but still we are standing at 2.27%, and next year it is 100%. So we should try by mid of this month, next month we should achieve some figures. And whatever support is required to the state of Maharashtra, NHSRC is always available with all the support we can give virtually or by physical visit or conducting the internal or external assessment, external assessors training. So whatever directions or support is required, we will be providing from here, but effectively it should be utilized at the state level to show some progress. Now I will hand over to sir to final remarks regarding this meeting and kindly guide us for the further how we can achieve the targets.
Thank you, Naveen ji and Neeraj ji, for this wonderful explanation about this NQAS activity. And you have briefly told the state also what can be done to achieve the targets, because the target is huge and the time is very less. So I request all the deputy directors, CS, DHO, MOH to kindly look into.
Sir, your voice is not audible.
We are expecting, now you are getting my voice? Santosh?
Yes, sir.
So I expect all the district authorities to look into. I just told in the beginning of the meeting that the DQSC shall work dedicatedly for this program only, no additional charge to him. Rather, you should give him additional
Not audible, sir.
So you should support him. The DQSC should be given additional manpower. Then you should plan that 60-70% of your facilities.
Kindly unmute and then try, sir.
Hello, now you're getting? Santosh Bhag. नवीन जी आ रहा है क्या आवाज? Hello.
I think some network issue. I'm not able to hear you.
अभी आवाज? हेलो, डॉक्टर मोती पोळे आवाज येतोय का?
Yes, sir. Completely audible.
येतोय ना? ओके. तो मंडळी आता त्यांचं काही टेक्निकल इश्यू असेल, एक 2-3च गोष्टी सांगतो आणि मग आपण थांबूयात. आपल्याला आता बेसिकली डिसेंबर एंड पर्यंत आपल्याला 50% फॅसिलिटीज यामध्ये NQAS मध्ये आपल्याला सर्टिफाय करून घ्यायच्या आहेत. हे ह्यूज टार्गेट आहे. तुम्ही बघितलं महाराष्ट्रात 2.27% ह्या आता आपल्या अचिव्हमेंट आहे सद्यस्थितीमध्ये. त्यामुळे सर्व DHO, MOH, CS तो तुम्ही मॅक्सिमम तुमच्या फॅसिलिटीज कशा स्टेटसाठी तुम्ही अप्लाय करता येतील हे बघा. तुम्हाला आम्ही 1 वीकचा आम्ही टार्गेट देतोय. विदिन अ वीक आपण सबसेंटर PSC तर आपण लगेचच करू शकतो, कारण त्यामध्ये तुम्हाला अप्लाय करायचंय. तुम्हाला त्या ठिकाणी तुमचे असेसमेंट कम्प्लीट करून 70% अँड मोर जे आहेत ते स्टेटसाठी तुम्हाला पाठवायचे आमच्याकडे ऍप्लिकेशन्स, आणि त्यानंतर आम्ही इथे ते व्हॅलिडेट करणार आहोत. व्हॅलिडेट करून तुम्हाला स्टेट सर्टिफिकेशन आम्ही देणार आहोत. जसं आता NHSRC च्या टीमने आपल्याला सांगितलं त्याप्रमाणे तुमचे सगळे ऍप्लिकेशन्स आम्ही असेस करून तुम्हाला वी विल कम्युनिकेट बाय अर्लीएस्ट. जसे तुमचे ऍप्लिकेशन्स येतील त्याप्रमाणे आम्ही तुम्हाला कम्युनिकेट करू. पण मॅक्सिमम संख्येने प्रॉपर ऍप्लिकेशन्स आले पाहिजे, म्हणजे डॉक्युमेंटेशन तुमचं प्रॉपर पाहिजे. इवन स्टेट टीमनी पण त्याच्यामध्ये आता प्रोएक्टिव्हली काम करावं. जे काही ऍप्लिकेशन चालले त्याच्यामध्ये क्वेरीज लगेच ईमेलवर मागून घ्या, त्यांना परत पाठवू नका, जेणेकरून त्यांचे वेळ वाचेल. त्यानंतर आमच्याकडून व्हॅलिडेट करून आम्ही कम्युनिकेट केल्यानंतर तुम्ही सक्षमवर अप्लाय करायचं आहे नॅशनलसाठी. मी आता रिसेंटली दिल्लीला गेलो होतो, त्यावेळी मी आपल्या NHSRC टीम सोबत माझे डिस्कशन झालेलं आहे. कारण आपण जेवढं लवकर त्यांना पाठवू ते सगळं प्रोसेस व्हर्च्युअली करणार आहेत. की आपल्याला सबसेंटर आर्म साठी आपल्याला व्हर्च्युअल त्याच्यामध्ये स्कोप आहे. सो यू कॅन अप्लाय फॉर व्हर्च्युअल असेसमेंट ऑन सक्षम फॉर सबसेंटर आर्म. म्हणजे आपल्याला ती संख्या मोठी आपल्याला अचीव्ह करता येईल. आपल्याला आपण बघितलं 5,900चं टार्गेट आहे आणि आपले सबसेंटर जवळपास 6,000 वगैरे आहेत, जे की बऱ्यापैकी त्यांचं इन्फ्रास्ट्रक्चर चांगलं आहे, सगळ्या गोष्टी तिथे अवेलेबल आहेत. तर DHOनी पण हे एन्श्योर करावं. हॉस्पिटलसाठी मी सांगेल की यू कॅन अप्लाय फॉर सम ऑफ द डिपार्टमेंट्स. त्यामध्ये लक्ष मुस्कान हे फोकस ठेवून त्याप्रमाणे आपल्याला NQAS मध्ये काही डिपार्टमेंट्स मध्ये आपल्याला सर्टिफिकेशन मिळतील का, स्टेट सर्टिफिकेशन मिळेल का, आणि यू कॅन गो फॉर नॅशनल, हे आपण बघितलं पाहिजे. कायाकल्प आणि IPHS मध्ये ज्या आता ODK टूल प्रमाणे ज्यांचा स्कोर 80% आहे, कायाकल्प मध्ये तुमच्या काही फॅसिलिटी ऑलरेडी आहेत, त्या लगेचच तुमच्या होऊ शकतात. तर त्या ठिकाणी तुम्ही इंटरनल असेसमेंट्स तुम्ही कम्प्लीट करा, गॅप फिलिंग करा आणि त्याला लवकरात लवकर स्टेटसाठी तुम्ही अप्लाय करा. एवढंच मी सांगेल. आपण आता इथून पुढे दर आठवड्याला उत्कर आणि मॅडम तुम्ही बघा की एव्हरी वीक वी विल रिव्ह्यू नाव, आणि जे काय आम्हाला पण अपडेट करत चला. सो विल ट्राय टू गेट इट डन. आपल्याला 50%चं टार्गेट आहे, पण तुम्ही 60 ते 70% ऍप्लिकेशन तुमचे येतील असं बघा. कारण ह्यामध्ये आता आम्ही स्टेट कडून फिजिकली तुम्हाला व्हेरीफाय करणार नाही आहोत. आम्ही फक्त तुमचे ऍप्लिकेशन्स आम्ही व्हॅलिडेट करणार, व्हेरीफाय करणार आणि कमिशनर मॅडमच्या अप्रुव्हलने तुम्हाला स्टेट सर्टिफिकेशन आम्ही कळवणार आहोत. त्यामुळे थोडीशी प्रोसेस रिलॅक्स झालेली आहे, पण हे करत असताना त्याची क्वालिटी महत्वाची आहे. की बाबा आपलं फिजिकल व्हेरिफिकेशन स्टेट कडून होणार नाही, पर्टिक्युलरली सबसेंटरच्या बाबतीत मी बोलतोय. बाकी ठिकाणी तर स्टेट असेसमेंट होणार, पण सबसेंटर आमच्या बाबतीत स्टेट असेसमेंट नाही होणार म्हणून कॅज्युअली पाठवू नका अर्ज. कारण त्यांनी आता सांगितलं बघा की आपण जर तसं पाठवलं तर 10% ते येऊन फिजिकली व्हेरीफाय करणार. मग त्यावेळी जर चुकीचा रिपोर्ट असेल, चुकीचा डेटा असेल, तर मग ते संबंधित अधिकारी पण त्याला जबाबदार असतील. त्यामुळे त्यामध्ये कुठली क्वालिटी आपली हॅम्पर होणार नाही ही काळजी घ्या. आणि आपण प्रायमरी हेल्थ केअर फॅसिलिटी सब सेंटर PSC वर आपण फोकस ठेवूयात की जेणेकरून आपलं 50% टार्गेट अचीव होईल. तो नवीन कुमार जी, आपको आवाज आ रहा है अभी? मला वाटतं disconnect.
Yes, sir, you are audible, sir.
Yeah. So thank you very much, Naveen Kumar ji and Neeraj ji, for joining this meet and guiding us. Thank you very much.
Thank you, sir. Always welcome. Thank you so much.
Now we will close it. Thank you.
Yes, sir.